Hi, welcome to Rounded Momma's YouTube channel. My name is Sherry and I'm joined by Sarah. We are both home birth midwives in the Las Vegas area. We are really excited to talk to you a little bit about supportive pregnancy. If you find this video helpful, like, subscribe, ring the bell, share with your friends. We love hearing from you. What is supportive pregnancy?
So Supportive Pregnancy is a program that was put together by the March of Dimes that is supposed to not only help you get like great prenatal care, but also give you that sense of community and education. Probably not so much in midwifery care, but a lot of like modern, I guess like obstetric schedules really don't allot a whole lot of time to get like questions answered or a whole lot of time to just kind of talk about general like educational stuff about like what happens during pregnancy or how to prepare for that. It's like a 2-hour event that you come and you have that time to spend with a midwife and other families like you.
I've always appreciated what the March of Dimes does. March of Dimes used to help provide centering pregnancy care, but now they've taken it one step further and they've created their own program because they just saw some other needs within the communities they were dealing with. So March of Dimes always has something they're working on, whether it be preterm births or they always have something that they're trying to get better numbers on. This particular program from the March of Dimes is so that individuals kind of don't fall through the cracks, so to speak, because a lot of individuals don't maybe have access to prenatal care or don't feel like they have a safe space with their care provider potentially. Las Vegas has one of the highest numbers of individuals who don't seek prenatal care at all and just walk into a hospital when they're in labor. Our goal at Rounded Momma has always been to offer affordable prenatal care, even if you weren't choosing a home birth. Actually, there's some of my favorite kind of relationships are those individuals that kind of come in and plan on doing a delivery at a hospital, but like the one-on-one of a midwife because we spend so much time developing birth plans and preparing them for what is to come. So we're kind of doing our own kind of hybrid kind of program of supportive pregnancy. And so you get some privates with your primary caregiver, and then you have the option to go as many groups as you want. And we're hosting anywhere from 2 to 4 a month, and you can pop in to any of them. What makes that so great is, like Sarah said, it builds community. Our lactation counselor is going to be really heavily involved in the program. So we're super excited to extend it past the labor and delivery and into postpartum so that you develop a team of individuals who will support you through that, whether you're struggling with breastfeeding or depression. So we really like that this can be an opportunity for you to meet other moms that are expecting in the community. Also an opportunity for a lot of our clients to meet all the midwives that work here. There are 5 midwives that work here, and although we are all our own clients' primary, sometimes my clients are like, but who would back for you? It gives you the opportunity to get to know all of us because we'll all be taking turns hosting the different groups.
Yeah.
And what is so great about that is we're going to tell you what we cover. And so a lot of times in those groups, it's almost like getting a childbirth education class. And so when you come, maybe we'll talk about birth plans or support people, or maybe you want to encapsulate your placenta and you have questions. And it kind of allows a really great open arena. The other great thing that we're going to be doing, you can bring your children and we're going to have some activities for your kids to do. So our student midwives have put together an amazing little program for the kiddos so that while you're getting to bond and meet with other families in the community, your kids will get to make friends with other individuals and maybe ask another birth professional questions about birth and what their role is. We're excited to do that because for us, we always recognize the family as a unit. And so we're really excited to be able to include the whole unit in this kind of group prenatal care. In a nutshell, that is what we are doing, and we are super excited. So if you are considering a home birth, come in and meet with one of our midwives. Consultations are always free. You can meet with anyone. We have a midwife down at the office 6 days a week. And so there's always somebody here that can talk to you. You just have to call ahead to make an appointment. We'll put the phone number right here. You can call and get a hold of us. Our business hours are 10 to 6. If you would like to go to the hospital, this also is a really good opportunity for you to get in and meet with a midwife because you still get that private care. You're still going to get your ultrasounds, your lab work, all of that. We can send you to a hospital with a complete chart and we'll handle that for you. We'll handle calling ahead and making sure they have your information. We're also going to have some cool doula programs. So doulas just got licensed, or the ability to license in our state, or to work with insurance or something.
Medicaid coverage.
Medicaid coverage. We would like our doulas to be involved in that too. So if you would need some additional support, we have some scholarship and sponsorship programs that will help you have support walking into a hospital setting, and you'll get to meet those humans during these groups as well.
When it comes to the structure of what a group prenatal looks like, you are still getting private one-on-one time even during the group prenatal visits. So the first 30 minutes of that time frame is a midwife taking you back and still getting your vitals, still listening to your baby, all of that stuff. So you're still getting those things in a private setting. We're not like listening to your baby and talking about your protected health information like literally in front of a bunch of other people.
That's a good point.
Really, that's like the social part of it. So you get a private amount of time, usually about 5 minutes or so, and then when you go out to the front, that's when we'll talk about like educational topics.
And we've made it super easy. Sarah has done all the things I've asked her to do. She always makes things so pretty for me. But when you come to Rounded Momma, we've created a workbook that you get that goes through all of the things. But with this program, you're going to get some additional information. The March of Dimes provides this healthy guide, and it's a really good, decent-sized book with a lot of really valuable information in it. You can see even it breaks down the months and what to expect with your body. It also comes with a pregnancy journal. I always highly recommend people journaling during their pregnancies, so I love that. And then Sarah's created super easy to understand ways of why it works. We even have the ability to mark your personal schedule down as to what would work for you and book your appointments in advance. Here's a list of all the different groups that we're hosting and who's hosting it, and the postpartum schedule. It gives you a really good, clear-cut way of understanding exactly what you're coming to, and gives you the freedom to kind of come when you want. So like if you are having a busy month and you just want to stop by a group and get checked out, and that's what works for you, then awesome. If you want a private, that works too. As far as funding goes, that's a perfect thing to bring and ask to your midwife, depending on whether you have insurance or if you're cash pay. But just know we're not turning anybody away with this program right now. So if you are not getting prenatal care because finances are an issue for you, please come by. We are making some very, very affordable and cost-effective ways of you being able to receive the things that you need to keep you and your baby safe and healthy. Don't hesitate to meet with us, even if you think money might be a problem, because we are not, like I said, turning anybody away. Thank you for joining us, and we look forward to seeing you next week. Take one! Like we ever take more than one takes.
Oh, here, stop, real quick. Come back over here. Every time I do the images, I don't have one of us both smiling in the same image. So this is going to be our cover. Ready? That one's perfect.